Have you ever wondered why the United States, one of the wealthiest nations on Earth, is the only developed country without universal health care? It's a question that sparks endless debate, frustration, and for many, real-life hardship. Today, we're not just going to talk about the problem. We're going to explore real, working solutions from around the globe. How can America provide free or very low-cost healthcare to all its citizens? Let's find out by taking a trip around the world without leaving our seats. First stop, Taiwan. Imagine this. You get sick, you pull out a single card, your health insurance card, and you can visit almost any doctor or hospital you want. Your copay is minimal, and your medical records are all stored on that one card. This isn't science fiction. It's the reality in Taiwan. They implemented a single-payer system in 1995, and it's been incredibly successful. Everyone is required to be insured, and the government is the primary insurer, funded through payroll taxes. The system keeps costs down through smart budgeting and negotiating prices for services and drugs. It's efficient, it offers choice, and it covers everyone. Could a system like this, one single streamlined insurance plan for the nation, work in the U.S.? It's a powerful idea to consider. Next, let's head over to Germany. Germany's system is fascinating because it's a multi-payer system that still achieves universal coverage. Most Germans get their health insurance through non-profit public sickness funds, which are funded by contributions from both employees and employers. If you earn above a certain income, you can opt out and buy private insurance. But here's the key. Both public and private insurers are heavily regulated. They can't deny you coverage for pre-existing conditions, and they must offer a comprehensive set of benefits. This creates a competitive market that's focused on quality and service, not just on profits. It's a model that combines personal responsibility with a strong social safety net. It preserves choice and competition, which are values many Americans hold dear, while ensuring nobody is left behind. Now, let's journey north to Canada, America's neighbor. The Canadian system, often called Medicare, is another single-payer model, but it's administered provincially. This means each province or territory runs its own health insurance plan, funded by federal and provincial taxes. When you go to the doctor or hospital, you show your health card, and the government foots the bill. There are no copays or deductibles for medically necessary services. This simplifies things dramatically. Doctors and hospitals deal with one government payer, which cuts down on administrative waste. While there are debates about wait times for certain procedures, the system ensures that nobody goes bankrupt because they got sick. It prioritizes health as a public good, paid for by the public for the public. What about a country that completely redesigned its system? Let's look at Switzerland. The Swiss model is unique and might sound familiar to Americans. It's based on a mandate that every citizen must purchase health insurance from a private non-profit company. The government provides subsidies to help lower-income individuals and families afford their premiums. This sounds a bit like the Affordable Care Act marketplace, but with a crucial difference. The insurance plans are highly standardized and regulated to ensure comprehensive coverage, and the companies are not for profit, keeping the focus on health outcomes rather than shareholder returns. It's a market-based approach with a strong social conscience, proving that private insurance can be part of a universal system if the rules are set up correctly. And we can't forget the United Kingdom and its famous National Health Service, or NHS. Founded after World War II, the NHS is built on the principle that good health care should be available to all, regardless of wealth. It's almost entirely funded through general taxation. Most services are completely free at the point of use. You don't get a bill after visiting the doctor or staying in the hospital. The government owns and operates most of the hospitals, and many doctors are government employees. This is what's known as a socialized medicine system. While the NHS faces its own challenges like funding and wait lists, its core mission has remained unchanged for over 70 years to provide comprehensive care for everyone. It's a testament to a nation's commitment to the well-being of its citizens. So, what can America learn from all this? The first lesson is that there's no single perfect system. We've seen single-payer models, multi-payer systems, and market-based mandates. But they all share common threads. They all agree that healthcare is a right, not a privilege. They all use some form of government regulation and collective funding to ensure everyone is covered and that costs are controlled. Let's bring it all together for the United States. We don't have to copy one country's model exactly. America can create its own hybrid system, taking the best ideas from around the world. We could expand Medicare to cover everyone, creating a single-payer system like Canada or Taiwan. This would drastically cut administrative costs, the billions of dollars currently spent on billing, marketing, and corporate profits in our private insurance industry could be redirected into actual care. Or we could adopt a German-style multi-payer system. We could keep employer-based insurance and private plans but regulate them heavily. Make them non-profit, force them to compete on quality and efficiency, and create a strong public option. A government-run sickness fund that anyone can join. This would preserve choice while guaranteeing a high-quality, affordable baseline for everyone. Another path is to build on the Affordable Care Act, but supercharge it with lessons from Switzerland. Strengthen the individual mandate. Make the subsidies more generous so that nobody has to spend more than a small percentage of their income on premiums. And strictly regulate the private plans on the marketplace to ensure they offer truly comprehensive coverage without loopholes. The key to lower costs in all these systems is bargaining power. A single-payer system or a large public option can negotiate much lower prices for prescription drugs, medical devices, and hospital services. Right now, every insurance company negotiates separately, and Medicare is legally barred from negotiating drug prices for Part D. That's like sending one person into a supermarket to buy groceries for the whole town, but telling them they're not allowed to ask for a bulk discount. It makes no sense. By pooling our collective bargaining power, we could slash healthcare costs across the board. Financing a new system seems like the biggest hurdle, but the money is already there. The United States already spends more per person on healthcare than any other country in the world by a long shot. The problem isn't a lack of money. It's how we spend it. Our current system is incredibly inefficient, with a huge portion of spending going to administrative waste and profits. By redirecting those funds, along with modest tax adjustments similar to what other countries use, like payroll taxes or value-added taxes, we could fully fund a universal system. In fact, most studies show that systems like Medicare for all would actually cost the average American family less than they currently pay in premiums, deductibles, and co-pays. This isn't a partisan issue. It's a human issue. It is about whether we want to live in a country where a medical emergency can lead to financial ruin. It's about building a healthier, more productive, and more secure society for everyone. The examples are out there. The roadmaps exist. From Taiwan to Germany, from Canada to Switzerland. Nations have proven that providing high-quality, affordable healthcare to all citizens is not an impossible dream. It's a choice. It's an investment in people. The path forward requires political will and a shift in our perspective. It requires us to see healthcare not as a commodity to be bought and sold, but as a vital piece of our social infrastructure, just like roads, schools, and fire departments. By learning from the successes of other countries, the United States can design a unique, American-made system that finally guarantees health and financial security for all. What do you think? Which model sounds best for America? Let me know your thoughts in the comments below. If you found this video insightful, please give it a thumbs up. And don't forget to subscribe for more deep dives into the biggest issues we face. Thanks for watching.